like weird compliment to give somebody. I'm the queen of weird compliments. Me and Carrie just like we're talking. We just jumped in the studio and then like we hug and I'm like, oh, you smell so good. But like really, like that's a weird compliment.
No, it's not. I am
you
such
do.
a smeller person.
Such a smeller.
I am the first one to tell somebody. It smells so
My mother-in-law, I wish I could find a perfume or like anything because you know how like some people like your chemistry will like change the smell of something. So sometimes you put on a perfume and they'll smell totally different.
Yes,
my
mom
chemistry is out of a dumpster, I think, because everything sours on me. I have yet to find like a perfume or a body mist that's like, oh, that's pleasant within 30 minutes.
I use a body mist of my perfume. So like most perfumes. Like there's like perfume, you know, that's more potent. And then there's like a body mist from like Bath and Body Works, you know?
Yeah. I got the Ariana Grande. My mother-in-law got it for me. I don't either, but I'm trying it out. And I don't think I smell like a trash can yet. Progress. Welcome, everybody, to the Medicare Cafe. You were joined by your hosts. My name's Olivia Richardson.
And I'm Carrie Vogt.
And Carrie smells
or
wonderful.
Volt, as all my clients yesterday like to say.
Volt. They put an L in there.
Volt. Yes.
Volt. Oh, I was at your office the other day.
You were?
See me. Yeah, I was.
I
snuck into your office.
You didn't knock on my window?
Well, you weren't there yet. It was, well, I say yet. I think you were. It was one of your days that you were being a mama, and I was dropping off cookies because I was also being a mama. Kate had like a
not next
sale.
door, like my.
I was in your office. I dropped him off at JK, which is your neighbor, and then I went over and saw you. I didn't see you, but Tim and Brandon were there. And some people I didn't recognize. Sorry.
The heads up.
I was actually decided I wasn't gonna tell you because I didn't want you upset,
That
and then like I forgot that I wasn't gonna tell you. So here you are.
Here I am. It's payback for when me and the girls tried to visit you here that one day.
Well, I'll tell you, it's the EP. That's what we were just talking about. Do you mind kind of sharing the story? Like, I know you felt bad about it, but I'm just like, it's AEP. Of course this happened. Like, of course, but it doesn't make it feel good.
No, it doesn't make you feel good. Just me, a story of me being totally human. I sent an email to one of my clients. Both spouses were my clients, and he's kind of the main, like, contact, and so I sent him an email with an update of my recommendations for him and his wife. He responded back. My wife died beginning of last year. We had a conversation about this. Please update your. And I was like,
"You're like, yeah,
he did," and it was marked in my system as deceased. And I just, in the hustle and bustle of AEP, I just was going too fast, and I didn't see it.
You know what's so interesting? Deaf Research, who is an incredible resource and a tech partner, they basically do studies every year that says like enrollment will spike by 20% the last week of AEP because you have all the non-carries, you have the Olivias out there that are procrastinators and will wait until like, oh, I have to get this done.
I agree with that, and it's not because of me procrastinating. I think it's clients.
Oh, that's me.
I average about 20, anywhere between like 15 to 20 apps a week, all AEP. And this week I already have 20 in, and I'll probably end close to 40.
So they're wondering, the couple questions they had, plus it was an election year, so people like procrastinated even more.
Talk about the election. 75% of my meetings.
Oh my God. Well, I get it. I mean, obviously, it's topical and crazy right now. But they're also saying that because consumers were so much better educated this year and had better expectations of shopping this year because of the election, people were doing their research on Medicare, the Inflation Reduction Act, smoothing. People were so much more educated this year that they're expecting a spike, but probably not the 20% that they're used to seeing. Plus, and not that there's one less week of AEP.
It feels like it,
but
though.
Everything because there was an extra week in November, so everything got pushed back. Right? Because usually, like, you're kind of used to having a week and a half, or
after Thanksgiving,
more than exactly, and we're only getting a week after Thanksgiving. So they're thinking that maybe that 20%, but there's still a spike, but maybe less than what was initially thought. Well, I do have some, I'm going to say updates. They're not really updates. During the Medicare Cafe, the last Medicare Cafe of AEP, we'll probably still do what's brewing after this one, just because it's still chaotic the week after AEP and everything. But it's the last Medicare cafe of the Christmas season. We're at, like, there is the light at the end of the tunnel. It's fine. My son's also going through this thing right now where, like, he just doesn't want to be in his own bed. So every night he's been coming and, like, knocking on the door and being dramatic about his entrances. He can't just come into the room.
In the middle of the night?
If I'm lucky. I mean, a lot of times it's at 3 a.m., 2 a.m., sometimes midnight. All that to be said, I have some updates for you guys as far as what's going on in the industry, some reminders, and just some general things to keep in mind. If you have any questions, comments, concerns, threats, or promises, that is my phone number. So text me either during the show or as you're watching the recording, and I will answer them as soon as
I also have my own question for you, a question that I get asked by several clients that I want to hear how you answer it.
Oh, well, go for it. I like
right now?
I love the pop quiz. Let's
okay.
do it.
And hopefully this isn't political, but it kind of, whoa, that ripped my sweater. It kind of is.
Have I been doing this?
No.
My brain's been telling me to poke the holes.
You poke away.
I haven't done it. Okay, I'm back. Okay.
So, with the new administration, everybody believes that Medicare, traditional Medicare, is going to go away.
Like original Medicare A and B?
Yes, that it's just going to be a Medicare Advantage option.
No, ma'am. That is not going to happen. Now,
I cannot tell you how many times I've gotten that question.
Yes. Yeah, I believe it.
But like, scary. Where is that information being spread? Because I don't see it.
A lot of it's coming from the new director of the CMS, being Dr. Oz. Dr. Oz is incredibly pro Medicare Advantage.
But that wouldn't mean getting rid of...
No, but it's everything political. There's a little thing that comes out here, and then the media and headlines blow it up tremendously. Right. So it is, I mean, a lot of it is stemming from Dr. Oz. Hasn't been voted in yet, won't be voted in until after Trump is in office, but has been nominated to take over with CMS. He is incredibly pro Medicare Advantage because he's pro small government.
Yep.
And so when a Medicare Advantage plan is privatized Medicare taking over and a consumer-based government plan, then of course, like, that's why he's pro Medicare Advantage. Just get it out of the government's hand, put it in private companies.
Okay.
But no, Medicare is not going away. Original Medicare is not going away. We will absolutely still see. I can't say exactly where I'm hearing it, but that's where I'm hearing it, is Dr. Oz's taking over CMS. So no, that's not going to happen. Now, you know that, we know that, but again, the media will do crazy things over the littlest little headline. If you guys, I will make a recommendation right now. If you're interested in learning about, and you would love this, if you're interested in learning about like politics and learning about like true legislations, what's going on out there, not just Medicare related, but there is Medicare stuff in it. A podcast I listen to is Unbiased. And I listened to it on Spotify. It's this girl, she was in law school, or not law school, she was a lawyer, and then she ended up starting this podcast, got really big off doing that, and is now doing that full time. But she goes through and actually, like, educates everybody about policies, educates people about legislation, educates people about politics, and is completely unbiased. You can't tell if she's a right-wing or a left-wing individual. So if you're interested in that, I listen to it every morning, Unbiased.
Yeah.
She's also, you can follow on Instagram. Her name is Jordan. It's Jordan is my lawyer, is her Instagram handle.
Like I may
it's very
follow
cool.
her on Instagram now that you say that.
And Brad says, it probably wouldn't be in the mainstream media, also putting fear in those willing to believe it. And again, it's fear mongering.
It is. And I knew that, but like, for me to hear it so many times. To hear it so many times, and for me to not, like, I don't know. Yeah. That makes sense. Like, because I knew Dr. Oz was a strong advocate for Advantage plans. But that doesn't mean, see you later, traditional Medicare.
Yeah, but it's like... So before we get into just other general reminders, I want to give you guys a really quick rundown of what was... Is
that her?
No.
Oh, okay.
Look up Jess as my...
Jess here.
No, Jess is my lawyer. Understandable. I think it's... Anyways.
Two Jesses.
Jordan is my lawyer.
Jordan is my lawyer. Okay.
So here are just some general updates from the CMS guidelines that were just released a week ago. I will say this is a really brief, quick thing. What was so interesting is that AI has gotten out of control. One of our agents actually uploaded the entire document into AI and said, make this into a podcast. and it generated AI voices sounding like human beings in a podcast format discussing I'll send it to you. It's incredible.
What?
It's really cool. You could think it was a little biased, honestly, which is weird that AI had a bias, but it did. But here's kind of where our compliance officer, Chaylin Jackson, I said, Chaylin, get me the things that are going to be the most geared towards insurance agents. There's a ton of stuff about home healthcare, a ton of stuff about obesity, a ton of stuff about AI technology in medical treatments. But I said, tell me what's going to affect the agent. So number one, a big rule that they're being proposed right now. Okay, the big one that's being proposed right now is making all client-facing materials marketing, meaning everything that you make, any type of marketing that you build has to be approved by CMS. So what it is today is that if you are just doing communication, there's a difference between communication and marketing. Marketing has to be CMS approved. The difference is that marketing is geared towards plan-specific or carrier-specific material. So saying a $0 premium or saying dental benefits or saying a gym membership. That's a plan-specific benefit so that it's considered marketing. It has to be CMS approved. But if you put
like a newsletter to your client.
Right, but if you put a newsletter out there or just said AEP is coming or a TikTok or something like that, they're saying, well, that's communication because you're not talking about plan-specific material. That's communication. Does not need to be CMS approved. This proposal would say everything now has to be CMS
That can't
approved.
pass. There's no way that could pass. That would get rid of social media altogether. Like,
So that's what's being approved. The second one would be basically would require agents to discuss low-income subsidy, Medicare savings programs, and trial right Medicare supplements, GI periods during Medicare Advantage enrollment. So basically making sure that we're talking about taking care of a client holistically.
Yeah.
I think a lot of good agents
now.
are already doing that,
Yeah.
but just trying to get rid of like the churn and burn, making sure you're spending enough time and
did
giving
they
specific
include
things.
IRMA on there?
No IRMA.
IRMA
just
should be included.
LIS, Medicare savings programs, and trial rights. So just
I
making
feel like
sure your
IRMA
clients-
is the least talked about of those and should be
Probably.
added.
Probably. But no, you're not wrong. But again, IRMA, what I'm imagining what's happening is trying to protect those individuals who, I imagine those who are
Subsidized.
no, what's it mean whenever you are succumb to, you are subject to IRMA. Thank you.
Succumbed to IRMA.
Succumb to IRMA. I always think IRMA sounds like a hurricane. But
Yeah.
those who are subject to IRMA are probably not being enrolled by the churn and burn people. They probably are going to more like advisor based. So probably not as much of it as an input here. More star rating changes. Again, we knew last week we talked about how United Healthcare won their suit against CMS, and so we'll continue to see star rating changes. More push for integrated D-SNP plans. So not D-SNP, well, I guess D-SNP. Integrated Medicare and Medicare Advantage, Medicare and Medicaid plans. So we saw the first step of that this year. Going to continue to see more integration. Would cover anti-obesity medication as a primary diagnosis and sets the foundations for guardrails to use AI in healthcare. So those were the major things that as an agent, you'll probably be answering questions or will affect your day-to-day. If this goes through, but Chandler wanted to make sure I mentioned that this is a new administration and or the new Congress, so that does not mean that these will go through. These are simply proposed right now and open for comment. So if you feel compelled or you're working with organizations like NABIP, NAFA, these pro-agent organizations, they're preparing their comments on this, but this is just proposed. We'll see what happens with the new administration. So those are your updates.
The marketing one can't pass.
It's wild. And here's the thing, right now it takes like 6 to 8 weeks to get a marketing piece, a true marketing piece.
You couldn't do your job. Like
Right.
you couldn't do your job.
Okay, a couple other things I want to remind everybody, and these are going to be just more like one more reminder, and then the rest of this are just like what our resources team is like. We're getting a ton of questions on this right now for the last week of AEP. The reminder is, or
Check
the
your
update,
pending apps.
that is a huge one. It's right there. Check your apps. The 48-hour rule for AEP business gets waived tomorrow because it is the last 4 days.
Today.
Third,
Today's
fourth,
the third.
fifth, sixth. Fourth, fifth, sixth, seventh.
Oh.
So it gets waived tomorrow. We're going to pretend you
Don't
didn't
turn
say
me in. I'm one today without it.
Don't turn me in. Well, it's tomorrow.
Don't turn me in.
Everybody report Carrie.
3 + 4 is 7.
I truly,
Do the math.
me and Ben sat like next to my office and was just like, couldn't figure it out.
Today.
So starting tomorrow, you still have to have a scope of appointment. Do not get that confused. You still have to have a scope. However, the 48-hour waiting period, if you're using AEP, is waived starting tomorrow, or if you're Carrie starting today.
Depends on your math.
Depends on how you math. And honestly, that's super fair.
I'd argue that was CMS, right?
Wait, it's math.
They would side with me.
Idiot. Also, just a couple more reminders, and then guys will turn you loose because these episodes are supposed to be pretty short. Medicare supplement right now. If you are going to be underwriting your Medicare supplement business, don't do it today, okay? Please wait until OEP to move your clients from a Medicare Advantage plan into a Medicare supplement plan. That is because right now, underwriting, there are some plans that advertise instant underwriting because they look at your medications that you're on. I have seen like, oh, you're instant underwriting, and then weeks later they come back and saying, no, we didn't approve you. So I don't trust, I've seen a couple cases of that. I don't trust it fully yet. Not yet. But if you're going to be underwriting somebody from a Medicare Advantage plan into a Medicare supplement plan, wait until OEP.
But you can still get them in the PDP?
Yes.
During OEP?
Yes. So wait until OEP, because if your client and you enroll them in a PDP now, it will no ifs, ands, or buts about it. They will be disenrolled from Medicare Advantage plan effective January 1st. That's all, there's nothing to it. And if they don't get approved for that Medicare supplement because something popped up that maybe they didn't tell you about and they don't pass underwriting, they now have original Medicare with a drug plan. So wait until OEP. You can disenroll them. It goes from January 1st to March 31st. You can disenroll them from their Medicare Advantage plan and enroll them into the PDP plan. You'll have plenty of time to get them on their meds up, so just hang tight to those.
I underwrote somebody, I think it was November 6th. Still don't have an answer. And I'm like,
yes.
What are we
what do
doing
I do?
here?
Right. No, that's exactly right. It's you just got to be so careful. If you don't hear back by,
and again, it's Cigna whose portal is god awful. All it says is pending. No RFI requests for information. Just pending.
I would for sure call.
Nothing. I know I'm calling today.
Yeah, I have the team. Another thing that our team is getting a ton of questions on right now is MACRA. And that is because a lot of people are in SAR. So what is MACRA? Just a reminder, MACRA is what happened back in 2019 to 2020. MACRA was instated to where it made Plan F and Plan C unavailable to those newly eligible to Medicare. And it made Plan G and Plan D guarantee issued for those in a guarantee issue situation. Why is that important? Well, a lot of people who have been on a Medicare Advantage plan for several years, maybe they are experiencing an SAR. Again, this is the biggest year of SARs we've had in a long time. A lot of them are trying to guarantee issue into a Plan G. They can't guarantee issue into a Plan G because they were eligible for Medicare prior to 2020. The only exception to that is going to be like a United Healthcare and a Cigna. Both of them will allow a GI into a Plan N, which is interesting, but it is at a reduced commission, so just keep that in mind. So if you are going to be using GI...
In Missouri, you can do... Oh, no, that's group plan.
Yeah.
I was going to say Anthem.
Anthem
G, but that's just from SAR.
Yeah. So just keep that in mind. If you are going to be using guarantee issue because of an SAR, any other guarantee issue situation, be aware when they were eligible for Medicare because it will affect if they're able to get a G or an F. The next update, want to make sure, again, check your app. So the love of God, there is not a lot of, ignorance is not bliss. So I have it every single year. Somebody said, oh, this app didn't go through. I didn't know it. I didn't know it until I didn't get paid on it. Or I looked at my portal at the end of December and I didn't see it. Unfortunately, more times than not, there's nothing we can. And so please make sure while you still can fix mistakes, check on your status of your applications. SAR SEP starts December 8th, goes until February 28th. So if you're still trying to scramble and help people after AEP, I don't expect AEP to slow down. I expect a significant slowdown, but still will expect a bunch of business.
Yep, with the SARs.
Everybody's expecting OEP to be just as wild as AEP. So keep
really?
That in mind. Yes.
Oh,
so keep that in mind. You take your break for a little bit. OEP is going to be wild. And then I already talked about the final ruling. So those are my updates, the top questions that our agent resource team is discussing or having conversations about. And we have
All
just
of
a
them.
few more days. 5, not 4. We have
4 more days. Oh,
You're scary. But for everybody else, there's 5 more days of AEP, guys. Make them count. I do want to say, as the last AEP or the last Medicare Cafe of AEP, of course, we'll be here next Tuesday.
Yeah.
But as the last Medicare Cafe of AEP, I just want to give a quick thank you to everybody, to our audience, to our agents out there, to our agents who've never heard of Medicare Cafe. It is incredible to you. It is incredible what you as insurance agents put yourself through over the 7 to 8 week period during the holidays, during inclement weather, during everything, and a stressful time of year. To be educating and telling people about how they're going to receive their health care is a really stressful conversation, and you guys are doing it hundreds of times over, and no 2 conversations look the same. So thank you to our insurance agents. Thank you to you all who are
thanks
truly
to you guys
providing this information
for
to our
keeping us in
seniors.
check
Well,
and educated.
it's the least we can do. As you guys keep. What is it? Are you familiar with Pitch? The game Pitch, the card game Pitch?
I mean, I know what it is.
It's a game where like this has a point. I swear. It's like whenever you have a partner, like you play this card game and your partner is a person who sits opposite from you, right? And so there's a saying in Pitch whenever like your teammate wins the bid, you say, you make them and I rake them, meaning that you make the points and I'll collect them.
Oh, there you go.
So that's what I'm going to say to you agents. You guys make them, we'll rake them. Appreciate your all's partnership and what you do for our seniors out there. I'm going to teach you Pitch.
I would love to play that.
It's so confusing.
I'm a gamer. I love to play games. Card games.
I've seen, so my husband and his dad, I was married into Pitch players. I didn't know how to play until I've been married now. It'll be 8 years here in a couple days. It'll be 8 years. But they tell stories about how Pitch tournaments, they were table flipping, hats being thrown at each other. Like, it's not that intense anymore.
That's like spoons with my family. We would hide the spoons like way far away.
Just
so you're wrestling
children.
Yes, it was a blast. If anybody plays spoons with their families, hide them
gosh.
like up the stairs.
Put them on stairs already. Like the falls aren't just like tumbles; they're like hospital visits.
Oh man,
love it. Well, guys, cheers to you all. Thank you so much for what you're doing for our seniors this AEP. Carrie, thank you for joining us on another episode. Again,
Thanks
if
for
you
having
have
me.
any questions, text that number. That is me, day or night. Appreciate you all so much. Until next time, guys.
so sweet.
I know. When did I get so sentimental?
sweet. I don't
I've
know.
gotten soft. Until next time, y'all, have fun.
Make money
and give impeccable service. Thank you.
Thanks.